Hello everyone, myself Dr. Prashant Punde. I am working as an Associate Professor in Krishna Vishwavidyapit, Department of Oral Maxillofacial Surgery. I am going to present my patented product, that is a plate positioning device. As we all know, due to increased civilization, industrialization as well as road traffic accidents, there is increased incidence of trauma which leads to multiple facial bone fractures. So we are talking about a lower facial bone, that is mandible. Mandibular fractures are second most common fractures which are occurring in the body after nasal bone fracture. So when we are treating these fractures, we need to follow Chamfy's osteosynthesis lines to provide better fixation as well as more stability to the fractured pieces. Conventionally, placing the mini plates is done through a naked eye by the operator, which may lead to following wrong lines of Chamfy's which are not parallel to the inferior border of mandible. So the basic purpose of this plate positioning device is to provide a stable template in order to place the lower border mini plate parallel to the inferior border of mandible. So if we see this template is made up of stainless steel or titanium, and this template has a lower border which is parallel to the lower border of mandible, and it has an indented up superior border which harbors the mini plate in position. Second advantage of this template is there is a midline notch which is present over the template. Now this midline notch can be coincided with the fracture line. Coinciding that midline notch with the fracture line ensures that the screws which we are going to place are equidistant from the fracture line. Conventionally, the problem which is solved by this template is it can present the mini plate position parallel to the inferior border of mandible, and it can place the titanium screws equidistant from the fracture line. The cost of production of this template is very less, comes to 80 to 100 rupees, and the marketed price comes to 600 rupees.